I'm Anne Marie O'Melia. I'm a pediatrician and child psychiatrist, and I work at the Lindner Center of Hope at the University of Cincinnati. I'm the medical director of that Harold C. Schott Eating Disorders Treatment Program. I was going to talk today about binge eating disorder. Binge eating disorder was recently categorized in its own separate classification in the DSM-5. Criteria needed to diagnose binge eating disorder have some overlap with other eating disorders, but they have criteria that are really uniquely theirs. So binge eating disorder is diagnosed when a patient engages in binge eating a minimum of 1 time per week for a 3-month period of time. It's important to actually get accurate diagnosis for a binge. A binge is categorized when a patient eats a large amount of food, more than people would normally consume in a given amount of time, and they have a subjective experience of a loss of control during that experience. So we all eat a lot at Thanksgiving, and we eat more than most people would eat in a given period of time. But it's a culturally sanctioned practice, and we are not usually feeling out of control when we do it. We've planned it, we've anticipated it, and we eat a lot of food. And that's not a binge. I have patients who come in and tell me, I just binged, or I binged so much yesterday, and what they really ate was an apple and a peanut butter, and they'd really only planned to eat the apple, so because they ate more than they had planned on a restrictive diet, they felt out of control while they were doing it, but they certainly didn't eat more than most people would eat in a given period of time. So that neither of those examples meet the criteria for a binge. So if a person goes to McDonald's and eats a super meal, and then that's not enough, and they go back and order another one, and they feel like they need to keep going, and they really haven't been able to stop themselves. That's what a binge feels like. My patients talk about it feels like they're on a train, and once they're on it, they're not getting off. They're going to ride it to the end, and there's nothing they can really do to stop it until either all the food is over or they have somehow finished. And it's a very distressing experience. They feel guilty, they feel ashamed. They usually are having very negative thoughts during the process, really feeling quite disgusted. They're usually doing it quite alone. They're doing it to the point where it's really quite uncomfortable. They're eating past the point of fullness. They're eating when they're not hungry, and they keep eating and don't feel like they can get themselves to stop. Binge eating disorder is newly classified independently in the DSM-5. It used to be categorized in the eating disorder not otherwise specified category. Now it's moved to its own classification, which we hope will actually make more people aware of it, including clinicians and patients themselves. It would be nice if this actually helps people seek and receive treatment. Most people with binge eating disorder are overweight. Most people are obese. But obesity in and of itself is not categorized as a mental illness. And interestingly, the main treatments that we generally use in a primary care setting for obesity can sometimes have unexpected and unwanted effects when we use restrictive eating habits or restrictive meal plans for binge eating disorders. The primary tenet of binge eating disorder treatment is to avoid food restriction. So even if a person has just binged, we ask them to wake up in the morning and go ahead and eat breakfast and follow a reasonable meal plan. So going on extreme diets, as is sometimes recommended for people with obesity, tends to actually not work for binge eating disorder, and in some cases can make it worse. So what does work? Cognitive behavioral therapy and behavioral interventions, where we're really looking at balance and a rational approach to food whenever possible. We try not to have any foods that are absolutely off limits unless they're known precipitants of a binge. Have people watch for areas where they may be at more risk to engage in a binge eating episode and start to monitor themselves and avoid potentially difficult situations and experiences. We work with cognitive behavioral therapy to take the emotional eating component out of the initiation of the binge with good effectiveness. We also have medications that can be helpful for treating binge eating disorder. In particular, the classes of medications we use are antidepressant medications, some of the anti-epileptic medications, some ADHD medicines, and other impulse control medications, and then some of the medications that we use in addictive medicines have been used for binge eating disorder very effectively. There are a number of combination medications that are under development for both obesity and possibly will have some helpfulness for binge eating disorder as well.